evening to the 8 p.m. edition of the Urban Debate. Tonight, we continue with our relentless focus on the COVID catastrophe because it is a catastrophe. Tonight, we talk about what is the true picture when it comes to COVID fatalities, lives being lost to this coronavirus. While the state governments, one after the other, face the heat of our courts and public alike over total COVID mismanagement. Here is another concerning trend. More and more cities, more and more states are allegedly misreporting on COVID-related deaths. In the past 2 weeks, reports of data mismatch has actually emerged from 5 states, including Gujarat, Bihar, Madhya Pradesh, and now we look at Delhi and Karnataka. Let me tell you what's happening in Delhi. And by the way, in the national capital, this mismatch, this fight between the MCD run by the BJP and the state numbers took place even in the first wave. After much outrage and debate, there was some amount of data correction that did take place there to give us a correct picture. Right now, it's the civic body again in the national capital that is taking on the AAP government over data mismatch. The MCD claims 1,500 deaths are missing from the Delhi government's record. I don't understand, viewers, why any government, any city authority thinks they can get away. They may try to block information, but I don't understand how they believe this kind of truth will remain hidden. For example, in Karnataka, there is a discrepancy of 760 deaths within the Bengaluru civic body's own records. Between different departments, BPMP records of different data shows a discrepancy. The civic body is giving us one number, the crematorium is giving us another number, and the discrepancy is over 700 deaths. In Patna, there is a mismatch between the data that the state government gives us and what the crematoriums are telling us. The government says 23 people have died in Patna on 23rd April. Crematorium data suggests 60 people were cremated there. Bhopal. And Bhopal is something we've reported on consistently, just like many cities in Gujarat. Inconsistencies in the data between April 21 and April 24th again continues, where we're seeing 100 cremations take place on one single day. The government says 10 people died of COVID. 94 cremations on another day. Government says 3 people died due to COVID. In Gujarat, the things are so bad and the contrast is so huge that even the High Court refuses to believe what is being shown by the state. Vadodara, Rajkot, Surat, the hospital data shows a massive mismatch story. Now, there are 2 things here that I want to talk about. Firstly, let's make it clear. If the governments believe by denying the reality of crematoriums, or by trolling us and slamming us for showing the so-called negative stories and pictures of cremation grounds and burial grounds, if they believe by trying to pressurize us, they can hide the reality, that's not going to work. You can put barriers as high. We will get to the sky and get the visuals to our viewers. And we only do this to show the reality. We do this to show the mismatch in the data. Now, one argument which can be taken sometimes is that the governments now increasingly are only recording the deaths due to COVID in hospitals. So if somebody has died outside the hospital waiting for their turn, or somebody has died at home, those are not getting factored in the government records, even though the crematoriums are recording that data. This means there are far more people in our country today dying because of coronavirus, and we are in denial of that reality. Here is another point. I am not saying that the COVID strain now has gotten more dangerous. that it's gone more deadly or fatal. But could it be that because of the large number of cases and the burden on our healthcare infrastructure, we are not able to save as many lives? That if we had the space and the beds and the staff and the oxygen and the testing facilities and the drugs, many of these lives could have been saved. Are we looking at a higher death count because our healthcare infrastructure has crumbled? Let's get real and let's talk facts. I say good evening to Sudhir Mishra, resident editor of Navbharat Times, Reema Nagarajan, editor for research with Times of India, Amulya Nidhi, national co-convener for Jan Swasthya Abhiyan, Dr. Anand Bhan, researcher for global health, bioethics and health policy, Dr. Giridhar Babu, professor and head for life course epidemiology at the Indian Institute of Public Health. Thank you so much to everybody for joining us. I want to start off with Mr. Sudhir Mishra. Mr. Mishra, you and I have had a lot of these conversations about the data mismatch. I can tell stories that I know personally linked to our families where even after the patient has died in the hospital, the family has been given a COVID negative certificate for the cremation ground. Those are the kind of attempts that are being made, Mr. Mishra, to suppress these numbers. Would you agree?
देखिए, ये बात तो बिल्कुल साफ है। हम लोग भी रोज डेटा देख रहे हैं, जो गवर्नमेंट का डेटा आ रहा है और जो बाकी यहाँ के जो शमशान गृह हैं, उनका हम डेटा लेते हैं। खासतौर से अभी अगर हम बात करें तो हमने सिर्फ दो जो यहाँ के बड़े हिंदू शमशान गृह हैं, जो एक इसको गुलाला घाट बोलते हैं और एक दूसरा वैकुंठ धाम है, तो उन दोनों के डेटा कल का अगर हम बात करें तो कल का करीब था 250 के करीब था, परसों भी ऐसा ही था। और इसके अलावा भी 3-4 यहाँ पे और शमशान गृह हैं, उसमें कुछ कब्रिस्तान हैं, कुछ क्रिश्चियन के कब्रिस्तान है, कुछ मुस्लिम कब्रिस्तान है, 2-3 हिंदुओं के और हैं। तो काफी ज्यादा संख्या होती है और वो संख्या जो अभी मृत्यु की संख्या आती है सरकारी आंकड़ों में, वो सबसे ज्यादा मेरे ख्याल से 40 के करीब आई, वरना 20, 18 ऐसे ही 10, मतलब इस तरह की संख्या आती है। तो आप इससे अंदाजा लगा सकते हैं कि और जब महामारी होती है तो जितनी भी मृत्यु होती है वो ज्यादातर उसके पीछे रीजन कोविड होता है। अब इस बार का जो कोविड वायरस है उसकी भी एक अजीब कहानी है कि कई बार वो आरटीपीसीआर में भी नहीं पकड़ में आ रहा है, तो और वो रिपोर्ट निगेटिव होती है और जब हम सीटी कराते हैं या चेस्ट का एक्सरे कराते हैं तब क्लियर होता है कि वो तो नुकसान पहुंचा रहा है शरीर को और कोविड ही है। अब पहले तो उनको एडमिट भी नहीं किया जा रहा था, लेकिन अब उनको एडमिट करना शुरू किया है। तो ये बहुत गंभीर बात है और मुझे एक बात पता नहीं क्यों समझ में नहीं आती, किससे छुपा रहे हैं हम अपने आंकड़े? क्योंकि डेटा जो होता है वो अगर आपको चीजों का सही ढंग से आकलन करना है, सही स्ट्रेटेजी बनानी है, फ्यूचर के सही प्लान बनाने हैं, तो हमारा आंकड़ा सही होना चाहिए। अगर हम सही आंकड़ों के ऊपर आगे चलेंगे तो वो हमारे लिए बेहतर ही होगा, क्योंकि हमारी तैयारियां उस तरह से होंगी। नहीं तो फिर क्या होगा, अब अगर हम गलत आंकड़ों के ऊपर ही सारा अपना वो रखेंगे या हम राज्यों की एक प्रतिद्वंदिता होगी कि हमने बहुत अच्छे से मैनेज कर लिया कोविड को, या कोई दूसरा राज्य कहे, महाराष्ट्र कहे या राजस्थान कहे या मध्य प्रदेश कहे या उत्तर प्रदेश कहे कि हमारी तो संख्या इतनी ही रही। लेकिन हकीकत तो लोगों को मालूम होती है ना। अब जो लोग सफर कर रहे हैं, जिनके घर का एक आदमी मर रहा है, जिनके प्रियजनों के प्राण जा रहे हैं, वो तो कभी नहीं भूलेंगे ना इस चीज को कि क्या हो रहा था। और उनके घर वाले की जो मृत्यु है वो आंकड़ों में आई भी, दर्ज हुई कि नहीं हुई। कि मैं किसी जिले का, गोरखपुर का या कहीं का देख रहा था कि कोई एक राजनीतिक दल का व्यक्ति कह रहा था कि मेरी वाइफ की डेथ हुई है और जिले के आंकड़े में तो कहीं कोविड का डेथ नहीं। तो ये बहुत दुर्भाग्यपूर्ण है, मतलब स्ट्रेटेजी के लिहाज से, रणनीति तैयार करने के लिहाज से। और मुझे नहीं समझ में आता है कि इसको छुपा के किस तरह का, मान लीजिए अगर ये लगता है कि इसका कुछ राजनीतिक फायदा भी मिलेगा, तो मुझे नहीं लगता कि इसका कोई राजनीतिक फायदा इन बातों का मिल रहा है।
शायद से जब तक इलेक्शन करवाने हैं, चाहे वो पंचायत पोल्स हो या किसी और प्रदेश में सिविक बॉडी पोल्स हो या असेंबली पोल्स हो, ये फायदेमंद रहता है कि आप सच्चाई को ना सुने। और उसके लिए हम किस हद तक जा रहे हैं उत्तर प्रदेश में, ये तो बहुत क्लियर हो गया है। द अटेम्प्ट्स, द काइंड ऑफ स्टोरीज एंड एग्जांपल्स दैट आर इमर्जिंग right from denial of testing the denial of even conducting an RT-PCR test, to denial of a COVID positive death certificate, to denial of what the cremation numbers suggest versus your own hospital data. I mean, that's the extent, and I'm not just talking about Uttar Pradesh. I'm looking at Bengaluru in Karnataka, where crematoriums are saying 155 people died. The civic body BBMP says 92 people have died. Crematoriums said on April 20th, 154 people died. Civic body said 70 people died. 147 on April 21st as per crematoriums, less than half as per the BBMP portal. That is what the mismatch shows. And my concern is, Rema, that when we try and push this narrative repeatedly, that all is well, it gives a false sense of assurance, not just to people, but also authorities who then don't plan, who don't increase oxygen cylinders, who don't increase ventilators, who don't increase life-saving infrastructure because they believe it's not that fatal. So, Rema Nagarajan, is your own analysis also showing this, that this is not a one city or a two city story, but a larger trend and a worrying trend that we're looking at across the country? Okay, I'm not too sure if she is able to hear us. Let me just bring in our other panelists as well on this conversation. Another one state that has openly and brazenly done this, Mr. Bhan, is the state of Madhya Pradesh. Now, even if we are to say, okay, they are just looking at state data and not the crematorium data or people who are dying outside on the streets or inside their homes, fact of the matter is this information will be required for us to prepare ourselves.
Absolutely. Thanks for having me, Tanvi. Any good public health system relies on sound data. In the absence of sound data, launching a good response obviously will become difficult. By underreporting either data on the true number of cases or on deaths, I don't think it serves any useful purpose besides perhaps political purposes or to show that the problem is not as bad as it is appearing. But everyone is seeing the truth, right? We're seeing visuals. Everyone has heard stories. Almost every family in every circle is impacted, and they know the kind of increase we are seeing in real life in terms of the number of cases as well as deaths. So given this, I think it serves no purpose not collect data. Perhaps there are problems with the system. It's not like we had a perfect system pre-pandemic and suddenly we are now not able to collect data in the same way. There have been concerns around adequate collection of data and certification of death, true certification of death, even before the pandemic. But all the more reason at this point of time for us to have a good handle on what the case count is and what the deaths are, especially so with deaths. When you lose someone to a disease, the family deserves closure. They also need acknowledgement that the government registers that as a COVID-related death, and it is leading to some kind of a policy response. If that is not happening, I think it certainly will continue to cause distress for that family, and is also again, not reflecting very well on any policymaker or state.
How much of it, Dr. Giridhar Babu, how much of it, the data, the death count that we're looking at, is also because we're not able to provide the healthcare facilities on time? And I want to talk about this because we're not trying to say that necessarily the virus or the strain itself has become more deadly. It's just that we're not able to perhaps handle the number of serious cases we are getting anymore.
Yeah, Tanvi, thanks for having me on the show. Let us put the number of deaths in perspective. There are nearly 8 to 9 million deaths per annum in this country, which means each day there are deaths between 20 to 25,000 throughout the country, which means in a district you'll have between 30 to 35 deaths every day. If these won't be noticeable by general population, mainly because people do not find who these 30 people are. But if we are obviously finding deaths happening in our neighborhood, in our communities, in our graveyards, much more than this load, then there is a perceptible difference in the general number of deaths and the excess number of deaths. And if this is real, then how much is it counted by the COVID 19 system, data capturing system? How much is outside it? You took the example of Bangalore. In Bangalore, there is system from the ICMR registry which goes to the hospital, and the BBMP, which is the Bangalore Corporation, captures it. The crematorium data goes on to a different Excel sheet and then gets reconciled maybe once in a month or once in 15 days. These data capturing mechanisms need to have standard operating procedures. Not necessarily every time people conceal the data by purpose, but because there is no system to record these excess deaths into the overall database. Finally, what is more important, which we have not done till now, is we need to do verbal autopsy of all the deaths to understand what is the cause of death. Once the total deaths are known in the community and you know the cause of death, then you can categorize. There are long term problems in terms of medical certification of death and death registration and all that. But those need to be fixed in the long run. But currently, we need to get our act right in terms of counting the death. My own belief is that if you do not count somebody's death in our data, that is disrespecting their entire life. We should not be doing that, not necessarily by purpose or by design or by default. We should now at least build mechanisms to understand how to count the death properly. There has to be a serious effort at the state and national level.
I understand what you're saying, that obviously there will be, deaths in a city that take place on a daily basis. But the conversations we've had with those at cremation ground, the gap which is there between the state records and what is happening at crematoriums, the fact that you're now running out of wood, the fact you're running out of space, you're creating more space for burial grounds and crematoriums, that your furnace iron is melting because it's been overused. This goes on to show what the official statistics don't show us. The official statistics, and I want to tell this to our viewers, on a daily basis are also registering a high number now in absolute terms, not in a percentage terms. But a 7-day average of daily deaths for our country has been 2,877. 2,800 people in the last 1 week have died on an everyday basis. Think about that, which is officially recorded. Add to it the fact that most cities that we've looked at are actually showing us just half the reality. So this data could be double. Then add to it that we are not even capturing what's going on in our rural India, in smaller towns and villages. So this data could go beyond that. And then you get the real picture of just how many lives, Reema Nagarajan, we are losing to COVID, whether it is for lack of healthcare infrastructure, for lack of timely treatment, or just the fact that we've now become so overwhelmed about it.
Are you asking me, Tanvi?
Yes.
Well, I mean, there is no doubt that all the records are not, deaths are not being recorded. Now, we can have a debate on whether that's deliberate or whether that's a systemic problem. Definitely looking at the scale of how many deaths are being missed, and also reading the signals that are coming from the state, it definitely looks like there is an effort to actually record fewer deaths. So that means there is an effort by states to show fewer deaths than actually are happening. So it can't be merely a systemic issue. Having said that, I mean, you also raised the issue about whether it's because of COVID or because of a new variant, or is it because of the health system? I can tell you from Delhi that it is definitely a system that is a problem. A lot of lives are being lost, not just because of COVID, but definitely due to lack of healthcare. We are losing a lot of young people who would have had a good chance of survival, but they're reaching too late. They don't get oxygen. Even when you have admitted them into the hospital. The hospitals are so overloaded that even when they get that rare ICU bed, the care that they are getting is not ICU level care. The doctors know it. The doctors are saying that they are helpless because where they might have been treating 50, they are treating 100 or more. And we haven't seen the scaling up of healthcare workers or the healthcare staff according to the number of patients who are coming in. And if we don't do that, we are bound to see a lot more deaths. And that won't be just because of COVID. It will be definitely because of lack of healthcare, the lack of systemic preparations.
Yes, absolutely, and that's the larger point that I want to make here. We've done way too many debates about saying that okay, there seems to be a concerted effort to suppress the numbers. Now you want to suppress the numbers because you don't want the world to know how badly you've mismanaged that. You want to suppress the numbers because you don't want to be counted as one of the states that's in a mess right now. It can be for whole different, various reasons. But apart from that, the larger repercussions of how we are unprepared, and if it gets worse from here on, we will be dealing with a bigger fatality count. That's the point I want to make here. And Mr. Amulyanidhi, the third aspect that I was saying, we are still only capturing or at least verifying data, death counts for the big cities. We don't even know what's going on in many of the smaller towns and rural India, where there is not even primary health care.
See, if you very openly see what's happening this year and last year. Last year, we know that we are not prepared. Okay, last year preparation was delay. Last year everything was new. The team was new in the state level, national level, and everything. So everybody tried to cooperate, and there was more analysis was going on. Last year also there were deaths happening, but this year we have almost a year to prepare. We know what is going to be happening. We know what are the referral system. Last year the analysis in the states, PPTs and presentation was telling delay in treatment, delay in identification. Then again, there was manipulation in the number of COVID cases, manipulation in number of samples. This was happening in Madhya Pradesh and other parts of the country. Now this year, we know everything. We know what is the referral system. We know why deaths has happened last year. We have tried to analyze some of the deaths. Audit has been taken place. But this year, what is happening? There is no universal data. The data from the urban and rural pockets, the entire focus is urban 8 to 10 centers. What is happening to rural areas? What is happening to district headquarters? There are deaths which has been reported as typhoid. There are deaths which has been reported as malaria. Along with there are typhoid cases, there are COVID cases. There is no data. The sampling is not happening. Then the referral system, the oxygen is exposed now. But what is the referral system? Where is the ambulances? Because it is totally dependent. The rural pockets in the country is dependent upon the referral system like ambulance and other stuff. Every district headquarters, all the patient which goes from rural areas or tribal areas to district headquarters, usually they refer to high centers like in Madhya Pradesh, you say Indore, Bhopal, Jabalpur, Gwalior. Then you can see have Delhi and other places like Surat, Ahmedabad and all these places. So these places, we don't have oxygen facilities. We don't have proper ambulance facilities. We don't have ICU beds. So what will happen? This data will coming and they are dying on the way. And there is no death reported. Because if you are not reaching to the hospital, this has been not. So this year, it is not mismatch. It is manipulation of the dead data, suppressing of the dead data. And this is forceful, purposeful. You see the New York Times report of Madhya Pradesh in Bhopal. In mid-April, 13 days, there was 41 deaths as per the government report. But as per the New York Times study, there was more than 1,000 deaths of the cremation ground. This is 24 times more than the deaths. But there is no death audit. There is no death analysis. So what we are going to suppress? This time, the whole strategy of the government, identification, isolation, testing and treatment has failed. It's collapsed. People have lost faith on the public system. The private sector is open. Last year, government was controlling ki sabko muft ilaj milege in Madhya Pradesh, another thing. This year, you are telling open. People are paying 2 lakhs and 3 lakhs and 4 lakhs. I got 50 to 100 calls every day सर अमूल्य जी एक बेड दिला दीजिए, अमूल्य जी ऑक्सीजन दिला दीजिए across the country. And despite all things, we are doing like the public sector. If you see the whole government hospital is captured by few politicians. बिना जुगाड़ के, बिना पैरवी के, बिना political leaders, you are not going to get a bed. 12 hours to 30 hours, and death is happening like it's a common. It's very shameful to see today newspaper what Nitish Kumar is telling. सरकार उठाएगी कोविड मरीजों के अंतिम संस्कार का खर्च. What is the role of government? आपको लोगों के अंतिम संस्कार का खर्च उठाना है या लोगों के इलाज का खर्च उठाना है?
You know, I want to just add, this attitude that you are talking about, it builds towards the same, because you don't take life seriously in this country. You don't take healthcare infrastructure seriously in this country. A Madhya Pradesh minister turned around and said, I agree that these deaths are happening. Nobody can stop these deaths. Not only me, everybody in the country is asking about cooperation for protection from coronavirus. But people are dying every day. People get old and they have to die. What can you do? You saw the Haryana chief minister who was questioned about it to say, don't get into the statistics. आपके चिल्लाने से जो मर गए हैं वो वापस नहीं आने वाले. इन आंकड़ों को देख के क्या? इन आंकड़ों को देख के आप अगली बार ये याद रखेंगे कि अस्पताल बनाना जरूरी है, ऑक्सीजन प्लांट बनाना जरूरी है, ऑपरेशनल वेंटिलेटर्स और उनके लिए ट्रेंड पर्सनल रखना अस्पतालों में जरूरी है. सिर्फ मुंबई दिल्ली की बात नहीं, लखनऊ, कानपुर, आगरा, शाहजहांपुर, भोपाल, अहमदाबाद, सूरत, राजकोट, पुणे, नासिक, बीड, the smallest of the towns and the villages across the country. I mean, the state of Bihar has literally gone on for a year with 5 COVID dedicated hospitals for the entire state, and they had elections. That's the level of, apathy that the states have towards people. Another one, we know this time that the infection is spreading faster. More people are getting infected. We've gone on to the extent of saying even in your own homes you wear a mask, you double mask if you need to. In such a case, when the infection spreads faster, what's the time band that you have to react from when a person goes from medium symptoms to serious and then gone?
So the time frame is not too long, but I think what is more important, Tanvi, is that once you start having worrisome symptoms, that will you have access to care? Because if you had access to care, if you had an ambulance which would come, which had oxygen supply, which could stabilize you, which could take you to a hospital where you would be provided emergency care, and if required, you would then be transferred to a COVID care center where stable care could be provided. If you needed ventilator or ICU beds, you would get it. But if you don't have any of that, if you are waiting for 12 hours just to get an ambulance, if oxygen is not something that you can get easily, if once you reach the hospital also there is a long lineup and you have to just lie on a gurney and maybe share something if you are lucky, and then you are just gasping for breath, forget even seeing a doctor, when the doctor or the nurses are busy with the 100 who came before you. That is the problem. It is not the nature of the variant, but it is the nature of the failure of the health system to be able to cope with an increase in the number of cases. And I think that is what we need to focus on. Certainly, viruses will evolve. Variants will be there. They can be more infectious. They could also be infecting younger people at a higher rate than last year, etc. And of course, all of those are important things. We need to do genomic surveillance to understand lots of things. But fundamentally, this is an issue around health system deficiencies, and that is what is being reflected in the way care is not. You go to rural India, now even urban India. But this is also the reality for a lot of individuals from lower socioeconomic strata. This is, they are not new to going to a hospital and being told, sorry, we don't have a bed for you, or we don't have a ventilator for you. Now, as it hits middle class India and upper class India, I think people are starting to realize why everyone who are considered activists in this country were clamoring for more investment in public health, in our health systems. Because, at times of the pandemic, it doesn't really matter whether you have crores in your bank balance. If there is no bed available, there is no oxygen available, it's going to bite you as hard as someone who has no financial resources.
That's a realization everybody has had. Like, we are all trying, we are, as much as people, one can help, but even the most well connected and well established people are unable to do this. That's what has happened in COVID. I wanted to ask this question to Rima as well. Rima, in your research and analysis in the past 1 year, is there any reflection of what kind of healthcare infrastructure did we add? And I'm right now not talking about the temporary quarantine facilities or the jumbo facilities that came up in the first month, but actual concrete life-saving equipment that we would have needed. Did any state really take serious steps to do that even after the first peak?
Well, obviously, from the kind of reports that we are seeing, that you had floated tenders for oxygen plants, but you never built them. You placed orders for expansion of ICU and getting the material, but you didn't do it. So all that goes to show that we really didn't take this so seriously as we should have. You didn't really expand your infrastructure the way you should have done. And instead, now when the things have become really bad, the government has the cheek to turn around and tell people that you are creating the problem by hoarding oxygen. You are creating the problem because there's misuse of oxygen. This is a classic response of a lot of governments that instead of taking responsibility for how they have messed up the situation, they are trying to put the blame on the people by saying that people are not being careful enough. People have not, people are adding to the problem by the fact that they are hoarding oxygen. Why do people hoard oxygen? People wouldn't need to go out and buy oxygen. People wouldn't need to be standing in queue to buy their own oxygen if they had faith in the system that when they reach the hospital, they will get oxygen. That is a basic that we cannot even guarantee a single person in Delhi today. Today, there isn't a single ICU bed available. There are hardly any oxygen beds available. So people are forced to sit at home even when they know that they actually need to be in a hospital. There is no option. We are 100% full. Every single bed is occupied, and we are adding about 25, 26,000 new cases every day to Delhi, and these are the cases which we have counted. If we say that 1% of these cases will need ICU care, that's 260 patients that you're adding who need ICU care. Where do you want them to go? If there are 0 ICU beds available right now in the city and you have 260 people who need ICU care, what do you want them to do? Who will take responsibility for them? That will be 260 deaths on the head of the government. The government has to take responsibility for the fact that, you find a way to, reach care to these people. You can't turn around and tell people that, this is your fault, you should have been careful, or that, you're mismanaging things. People wouldn't have to do this. People are being forced to do what they're doing. Nobody wants to do what they're doing. They don't want to be standing in queue. They don't want their loved ones to be standing for hours outside the hospital and dying at the door of the hospital and not being able to get care. I mean, this is happening in the capital of the country. We are talking about rural India. We can't even provide basic care in the capital of the country, which has so many tertiary care centers. So many centers. I mean, we have the Premier Institute, AIMS here. We have large 1,000, 2,000 bedded hospitals here. We still can't provide care to people in the capital. What are we talking about rural India?
No, you're absolutely right. In the national capital today, it is next to impossible to directly on time get the critical care, the oxygen bed or the ICU bed that you need. Every day we are flooded with messages with desperate people. There are reports that are coming in of those who are waiting, and by the time they finally get a bed allotted, even before they get to the bed, those lives have been lost. That's, and a minute, every single minute here, Dr. Girdhar Babu, counts. When a patient is serious and it takes us 10 hours, 12 hours to find one ICU bed that gets allotted officially, by the time the patient reaches and help is provided, countless cases of how it's been too late. So how do we fix this gap now? Or do we simply lock ourselves up and pray that we are able to save some lives?
Tanvi, this is a real difficult question which has to be answered by the governments over the past several decades. As well put by both Rema and Anant, we do not have fit-for-purpose public health system. Year by year, we are increasing the expenditure on reimbursements to private health facilities where the treatment is given, and we have a national health authority created just to reimburse the expenses of curative illness in the private sector. What prevented the governments from stepping up the critical care in every district hospital, in every taluk hospital? Why have we imposed this restriction on expanding the capacity of the public health system? This has been done over several decades by all the governments. Every government is responsible for it. Even now, I'll just give you an example. In the United States, 17% of the GDP is spent on health, and most of it goes to drugs, insurance, and pharmas. We are aping that model by ensuring that insurance mechanism is expanded to all the curative illness, while people are allowed to have illness for a very long time. We need to overhaul, change in the entire public health system, the way we take care of health of the people. We need to be looking at prevention of diseases, health promotion. Only then the critical care capacity can be catered to. And let us be very realistic in this. Overnight, we can't increase the number of ICU beds and people who help in these ICU settings. Right now, what we are doing is firefighting. And after this pandemic is over, most of the people will forget this. And then when the next pandemic comes, each year with infectious diseases, many people die. With the same problem occurs with every disease which requires critical care. And we are not worried about it. Now we are worried because all of this is available for us to see within a day. Why we need a stronger public health system is because we need people to be healthy, the society to be healthy and have productivity in the longer run. We aren't doing that. We are only looking at curative illness, especially from the private sector where we need to reimburse for the care there. Why have we sort of outsourced curative illness care to private sector? Why can't we have similar in the government sector? There are good models within the public health system, whether it is AIMS, whether it is Jayadeva Institute of Cardiology. Why can't such tertiary centers be built in every taluk, every block, every district? This is the time for introspection. But for the pandemic management, we need to be stepping up oxygen supply, redistribution, ensure that we prevent as many deaths as possible. And we have a chance to prevent these deaths in the third wave, where by expanding the vaccination, we need to focus on this.
You know, and I want to emphasize on this, Dr. Babu, because we spoke about it in the first wave, saying there will be another round, there will be a second wave. The whole entire world has gone through this cycle. We, for some reason, and our policy makers and decision makers, Mr. Sudhish Mishra, forgot about it. हम भूल गए पहली वेव के बाद, या हमको पड़ी नहीं थी कि एक और राउंड आएगा. फिर हम स्टेट के इलेक्शंस में बंगाल से केरला तक हमारे मुख्यमंत्री जा रहे हैं कैंपेन करने के लिए, हम उन चीज़ों में बिजी हो गए. और अप्रैल तक, जब तक सिचुएशन इतनी ख़राब नहीं हो गई कि फिर हम उठ के बोले कि ऑक्सीजन कहाँ से आएगा, किसी ने ध्यान नहीं दिया पिछले 6 महीने.
ये मतलब बहुत आश्चर्य की बात है, क्योंकि ये बात सबको मालूम थी. सारे दुनिया भर के जितने भी विशेषज्ञ हैं वो ये कह रहे थे कि भारत में सुनामी आएगी. तो क्यों नहीं तैयारी थी? अब आज का हाल मैं आपको बताऊं. अभी लखीमपुर के एक विधायक का लेटर मैंने देखा, अभी व्हाट्सएप किया किसी ने, कि वो इस लखीमपुर एक छोटा जिला है उत्तर प्रदेश का, और पंचायत चुनावों की वजह से गांव-गांव तक कोविड का फैल गया है. काफी मृत्यु भी हो रही है, लेकिन वहां कोई जांच नहीं हो रही है, वहां कोई पड़ताल नहीं है. वो आंकड़ों में लोग नहीं आ पा रहे हैं. अभी लखीमपुर के विधायक ने, जो कि भारतीय जनता पार्टी के ही विधायक, उन्होंने अपने डीएम को लेटर लिखा है कि मुझे कार्यकर्ता मानकर मेरी बात को सुना जाए कि 100 से ज्यादा लोग मर चुके हैं. अब तक सैकड़ों लोग वहां मर चुके हैं कोविड से, और हमारे 10-20 साथी मेरे पर्सनल कोविड से मर चुके हैं. तो ये स्थिति सिर्फ एक लखीमपुर की नहीं है. उत्तर प्रदेश के जो तमाम जिले हैं, आप सोचिए डेटा कहाँ जा रहा है. मतलब क्योंकि गांव-गांव पहुंच गया है, और गांवों में वो इंतजाम नहीं है. लखनऊ में तब भी आपको लोग दिखते हैं कि ऑक्सीजन के लिए चिल्ला रहे हैं, हॉस्पिटल में बेड नहीं मिल रहे हैं. वहां पे तो ये स्थिति है नहीं. वहां तो जांच ही लोग नहीं करा रहे. ये अलग बात है कि शायद वहां पर उतना ज्यादा घातक असर नहीं है जितना शहरी बस्तियों में है. आज भी मतलब जो डेथ्स हो रही है वो उतनी बड़ी तादाद में नहीं हो रही है जितनी शहरों में हो रही है, लेकिन हो रही है. मतलब कभी गोंडा के गांव से खबर आ रही है, कभी गोरखपुर से आ रही है, कभी जौनपुर से आ रही है. और करीब 400-500 टीचर्स जो सरकारी उसमें चुनावों में लगे थे, उनकी डेथ हो गई है. तो बड़ी विचित्र सी स्थिति है. ये चुनाव ये चुनाव टलने चाहिए थे। हाई कोर्ट ने इसको पता नहीं क्यों कहा कि ये होने चाहिए और गवर्नमेंट को इसके खिलाफ सुप्रीम कोर्ट जाना चाहिए था। ये चुनाव इस समय बिल्कुल नहीं होने चाहिए थे और उसकी वजह से उत्तर प्रदेश में जो संख्या आप देख रहे हैं जो बहुत ज्यादा बढ़ रही है, उसके पीछे कारण ये है कि अब छोटे जिलों में, कस्बों में और गांवों तक में ये पहुंच रहा है और इसका असर है कि बीजेपी के, भारतीय जनता पार्टी के भी 3 विधायकों की डेथ हो चुकी है। और पार्टी के अंदर यहाँ उत्तर प्रदेश लखनऊ में मोहनलालगंज के सांसद हैं, वो लगातार कौशल किशोर पूरा बखिया उधेड़ रहे हैं जो स्वास्थ्य का सिस्टम है। ब्रजेश पाठक चिट्ठी लिख चुके हैं जो कैबिनेट मिनिस्टर हैं और तमाम विधायक लोग भी लिख रहे हैं। तो ये स्थितियां, इसका आकलन नहीं कर पाना, तो फिर ये जो विशेषज्ञ बैठे हैं आपकी जो टीम 11 है उसमें लोगों ने क्या किया था, उनको उनकी क्यों तैयारी नहीं थी, ये सोचने का विषय है। और ये जवाबदेही भी होनी चाहिए कि क्यों नहीं किया गया।
आप ये कह रहे हैं और क्यों नहीं किया, क्योंकि हम भूल गए और हम अब एंड इट रियली infuriates me when people turn around, even sometimes experts, and they say, oh, it just hit us by surprise. Nobody was expecting this. Nobody thought it would get this bad. Experts have, top experts have been saying it on our channel through December, January, February. Firstly, Dr. Bhan, that we don't know why the numbers went down in month of January when everything was open. Why the numbers were still down, we didn't know. But we did know that there would be another way because it's been everywhere and we still didn't prepare. And today, court after court is questioning the states on why are you hiding the numbers, whether it's the COVID numbers or it's the death numbers, because this is a way of suppressing what their own failure is. I mean, the High Court told the Telangana government that we refuse to believe these death figures being furnished by you, and we want to know what is the number coming in from the crematoriums in Hyderabad and in the states. It is said that there is a disturbing trend of bodies being piling up. We have stories where over 20 bodies were put in one ambulance and taken. We have stories where people have spent the entire day, the entire night at the crematorium because they are having to wait. Lines and piles of bodies simply because we did not hear the warning signs that were there. Anand Bhan.
Yeah, absolutely. I mean, I think we were fairly lucky that we had a breather. Last summer we had an increase in the number of cases, but then the cases started going down and actually remained down for an extended period of time. It was a good breathing space for us to rebuild the health system, look at what our capacity was, start planning for enough reserves, give a break to our health workers who had already gotten very tired and burnt out at that point of time. But what did we use that break for? We had large congregations, we had political rallies, we had elections announced. We seemed to announce that everything is okay now and you don't need to worry about it. There was poor role modeling, poor usage of masks, etc. And those were all factors probably which have contributed to the kind of rise that we are seeing. I mean, such an acute rise cannot just be because of the virus or a mutation or a variant. It is because of a whole lot of these factors which enabled the spread of the virus, which enabled it to reach parts of India where the health system is even poorer than what we see in cities, and just poor mismanagement of the period where we could have spent a lot of time actually planning for the possibility of a wave which could come. As you are rightly saying, there were experiences from other countries. So clearly there's been policy failure. And, I want to reinforce what Giri said. I think the easy thought at this point of time, though it's extremely important to respond to the emergency we are seeing in terms of stabilizing the health system, having more oxygen, having more beds, having more care available, is to not remember the lesson from last year, which is now being reinforced, that we need to reinvest in primary public health care, which means that we should have a functional public health system, right from PHCs to community health centers to district hospital to tertiary care, so that you are able to manage many of these cases early enough at the local level and don't need to rely on tertiary care. There are not just patients in Delhi from Delhi, there are patients coming in from surrounding Delhi because there is hardly any care available in rural areas. So anyone who is critical is probably being ferried to state capitals, to district heads, because they're not able to be managed at the local level. And there are lessons from many of our neighboring countries in how to run PHCs and CHCs well, and also use them effectively for vaccination purposes. So if we rebuild our health system in a way that we have functional facilities at the local level, you can stabilize individuals, you can provide good quality care, and more importantly, you can prevent infections, you can prevent long-term chronic disease and its manifestations. So I think that is again something we need to keep talking about, that let's not use this as another reason to just invest in tertiary care by building more ICUs, beds and ventilators. That might be required for the short term, but what is good sound investment is really rebuilding our health system from the bottom up, and the bottom is actually primary healthcare.
Yes, primary health care, of course, in the long term. In the short term, what do we do? That's the other point, and I cannot emphasize on this enough. In this month, if you put together only the official death count, it's over 41,000 lives that we've lost in our country just in the month of April, only the official data that the states are reporting. So much more that is going unreported, which is now cannot be denied. That is the fact. Are we really ready to see these kind of fatality numbers? And when will we wake up to this reality and accept it? And then start changing things. Mr. Amulya Nidhi, ये तो official figure है. I don't even know if anybody has been able to do even a rough math to say what could be the real figure of what we've lost to COVID.
See, if you see the deaths, in the month of February, the official figure was 2764. March, almost it was double. And April, you told that more than 41,000. And if you see this one study of New York Times, it's 25 times more. If you see the districts data, for example, in Madhya Pradesh, there are deaths due to lack of oxygen in Sadol, Anuppur and all that. The government, there is no data in the what's happening at the district level. So this is, the intention here is not this. The intention is very clear with the government that they don't want to rebuild the public health system. Where is Ayushman Bharat? Where is all these schemes? So this, the whole issue, this is planned. The data has been suppressed. The data has been manipulated and the data has been centralized. There is no single press briefing by the government of India on death data. There is no single investigation because government just keep that people are dying. Government is not sensitive. Government is not thinking about each and every death. There is no meeting in the districts and there is no meeting, there is no press briefing, there is no official data how many deaths is happening. Why there is no data about district-wise data in the country, how many deaths happens today? There is no data. Do you have any data? And there are lots of reports in the district. They would try to suppress this data and somebody reveal the data, they threaten them in the districts. कि we will हम देख लेंगे. So the whole intention was very clear. There, what we want, what Jan Swasthya Abhiyan and all the civil society, all Anant and everybody is sitting there. What we want public health system strengthened. We want universal health care.
Yes.
But what government want? They want to privatize the whole health system. In the month of February last year, Niti Aayog want to hand over all the district hospitals. They don't want this. They want to hand over everything to the private corporates. So their intention is not to build the public health system. Because why not? Where is the Ayushman Bharat? So nothing. So their intention is very clear. They don't want manpower. They don't want infrastructure. They don't want supply system. This they just want. Why not? They are not recruiting the manpower. For example, if you see what we are arguing, Delhi and every place is oxygen and ventilator. I am getting into the hospital as a COVID patient. Where is the doctor? I am not getting the injections. I am not getting the ambulances at time play. 12 to 15 hours average waiting list time in the hospitals. There are boards. We don't have beds. What we will do? And if you put oxygen cylinder at our home and if deaths will happen, it will be not reported. And then collector will come and take your oxygen cylinder because they are telling you are doing illegal. So this is the whole centralized system. Either you put it open or you put it in the centralized system, then you put, why not the officers of the government, there are deaths is happening, manipulation, those who have manipulated this data, they should resign
But why will they,
This
Mr.
takes
Amulya
moral
Nidhi?
responsibility.
It suits the narrative of everybody. It suits the UP government to not acknowledge how bad things are so they can continue campaigning in other states and holding panchayat polls in their own states and then mocking the Kerala model. It suits the Telangana government, which is now being pulled up very badly by the High Court because they have gone ahead and held elections, municipal elections, civil body polls in their own state. And no state wants to admit just how bad the situation is. It suits Gujarat to come up with the most bizarre excuses, from the furnace in the crematorium melted because it was hot outside, to saying that all these deaths are not due to COVID, to then saying, oh, we don't record this data because they didn't die in our hospitals. They still died of COVID. They still died waiting in queue for treatment. They still died running from one hospital to the other. Countless stories every single day we are getting from across the country about how people ran pillar to post, called helpline after helpline, shared information, begged, pleaded for help. And by the time they were just about to get a hospital, or in most cases didn't even get that, the patient was gone. These are the lives we could have saved. Not only have we let this country and the people down by not building the right kind of health infrastructure over years, and in the last 1 year, we have let them down again by denying their deaths, by hiding the reality, by making it sound frivolous to say, तो क्या हुआ, चिल्लाने से या बोलने से लोग वापस नहीं आ जाते. At every point, we are disrespecting lives and the value of human lives in our country. Thank you for joining us.